All right, well, we are 6 months into this coronavirus health crisis. Our entire world has really been affected, and people in many industries are starting to gas out. 9 on Your Side's Tasha Davis spoke with 2 University of Arizona nurses who are looking for ways to mitigate a nurse's burnout during the pandemic.
In a pandemic that relies heavily on the expertise and passion of our healthcare workers, we've seen many doctors and nurses working longer hours and even risking their own health to care for those in need.
This is a pandemic that's going to continue to go on, and a lot of healthcare providers in different settings have already been asked to work overtime shifts or extra shifts. And so the thing is that that's just increasing the burnout.
Before the pandemic, burnout was already a normalized issue in nursing. And what I mean by that is that more nurses than not experience burnout than those who have what I would call good well-being and don't suffer from burnout.
Nurses Jessica Rainbow and Chloe Litson are seeking ways to mitigate nurse burnout during the coronavirus pandemic. And they say the pandemic has only intensified the problem.
They either leave the setting that they're in, let's say they're in one unit, they go to another unit, they leave that facility going from, let's say, the hospital setting to the community setting or vice versa, or they leave nursing completely.
And that puts the industry in a tough spot. The nursing shortage also affects the ability to educate future nurses and the ability to do more research.
It's important to say that this is not an issue that is the nurse's fault, right? Or any healthcare provider or anyone who works in a healthcare setting.
From their research, they say healthcare workers are shown to have good self-care, but it's the systems of the work environment that can be stressful.
You know, it's important to give grace in struggling times, and everyone's emotions are heightened and stressed. And, you know, nurses are people too. They're also a human being, and they're also suffering with you.
They found nurses have been doing things like meditation, spending more time in nature, and seeking peer groups to voice shared experiences.
Social support is huge for nurses. I mean, especially too when you are a provider and you have a job where your significant other at home may not fully understand what you do. And so it's difficult sometimes if you don't have social support of other coworkers in the same position.
The links to Dr. Rainbow's study and Litson's study are on our website. Tasha Davis, KGO 9 on Your Side.